What up, y'all? It's your boy Brad. I'm out here making this video on this beautiful day. There's some kids out here playing, so if you can hear them in the background, I apologize. Try and bear with it, but I figured I'd bring y'all outside. A little vitamin D does the skin good every now and then. So anyways, before I start, I wanted to tell you that I'm making this with a new camera. Instead of recording it on my iPhone like I used to, we got a new camera now. Got it set up on the tripod, so hopefully I can start bringing the better quality of video to you guys. But anyway, this video is about my second week of nursing school. A lot's going on, a lot's happened. It's really getting chaotic at this point. I'm starting to feel it already. Homework assignments, pharmacology assignments due. It's really starting to build up on me. But anyway, I'm trying to stay ahead of the game. You know, we got like medications that we have to research and do drug cards on for pharmacology, which I've already done all of mine. Let's see, this past week, okay, we had a simulation where we got to go into our local clinical site that we're going to be going to. We got to go into their documentation, and we got, you know, simulation patients that had whatever their various conditions, what they were being hospitalized for, and their different medications, and we got to go in there and play around with the documenting to get a feel for it as our first clinical day approaches. We did that. Let's see. If you don't remember, my clinical, I'm doing the clinical site at the local hospital, and it's on a med-surg floor focused on renal patients. But the first day of clinical isn't until, let's see, I think today's the 17th. It's not for another month. It's like February 20th is our first clinical day. So that being the case, what are we going to do until then? Well, starting Tuesday, because we're off Monday for Martin Luther King Day, starting Tuesday we have simulation clinic where we're going to go to campus. It's on campus, and they set us up with, you know, basically a simulation patient. They have a background, and there's going to be actually 3 different stations set up with 3 different patients. And I believe the first station is where you practice introducing yourself, knocking on the door, explaining what you're going to be doing. You're their student nurse for the day, etc., etc. And I believe it also, either that station or the second station consists of a head-to-toe assessment, which we haven't even been taught how to do that yet. Of course, it's only the second week, but we're already going to begin doing that. It's kind of throwing us in the fire sort of deal, but I like that. I think that's the best way to learn, is just being thrown into it, hands-on. You gain more experience through hands-on activity than reading about it in a textbook. So head-to-toe assessment is the second station, and then the third station, I believe, is medication administration. You know, we've already been given the patient's names and their backgrounds to go ahead and study up for this first day coming up, and so we need to look up their drugs, know what they're going to be doing, and they're going to select one of the drugs, and we're going to practice administering it. And I believe it's going to be a PO medication. We're not doing IVs yet. That's pretty interesting. That's pretty exciting. Oh, also, I got my electronic books finally, so now I can study, which is exciting, so I don't feel like I'm just set up for failure come this first exam, which is in like 2 weeks. So I actually have a little bit of time to study. Also, the physical textbooks that I showed you all, those are like review modules. They're not the actual textbooks, but it turns out there was a big mix-up with the bookstore. We weren't even supposed to get those. They were supposed to be electronic also, and those are through ATI. So they are, they gave us electronic versions as well for free, so that was nice. And what's really awesome about these, you have the ATI ebooks, and then our main ebooks, our actual fundamentals of nursing book and pharmacology and med math and dosage calculations, they're through Lippincott. Lippincott and ATI both offer services that come as part of the package that we were forced to buy, that we had to buy. I don't mean to sound so negative. It's really great though. You can take practice assessments focused by concept, which we're concept-based curriculum, or by chapter, however you want to do it, and you get your score, and it computes what your weaknesses were. So then from there you can take a focused practice test, focused strictly on your weaknesses, and sharpen your skills until you feel prepared and you're at a particular mastery level to where you can, you know, feel that you're going to do well on the test. So I mean, I thought that was really awesome. There's also a database, you know, like through the Lippincott, there's a database, a drug database basically. It's a drug guide. It's an electronic drug guide, and it's updated every 10 days. So it's always going to be the most current. You don't have to worry about buying a 2014 drug book and now it's already out of date because new drugs have come on the market and that are actually being given in the hospital setting. So I thought that was really awesome also. But yeah, that's pretty much it. That was week 2. Oh, and not to mention, I'm also having anatomy and physiology too on top of all this madness. But it's exciting, it's awesome. I'm enjoying every second of it. I'm enjoying it. And oh, one other thing I almost forgot to mention. We had our orientation at our clinical site, the major hospital. We had our orientation. Everybody, it's like 50-something students in my class of 2016. Yeah. We had to go for our orientation. And you know, we got presented a PowerPoint and had a nice little breakfast with coffee and refreshments, and just got to sit there and listen to them talk and tell us what we can expect at their clinical site, at their clinical settings, how things work, how things operate, their mission statements, things of that nature. But it was really nice, and that was the first taste of the hospital, and I'm excited, man. It's about to be on and popping. I mean, I'm already knee deep in assignments and studies, but it's going to be awesome here in the next few weeks. So keep looking forward to it. I should have more videos coming up. This is week 2. I might do a week 3, like I said in my last video. I'm not necessarily going to do this every week, but if I have a second to breathe, then I might do a video for y'all. But I hope you enjoyed. More videos are coming. Y'all have a good one. This is Nurse Bass, soon to be. Whoever, I know some of you all didn't start nursing school until like last week or maybe this week. So for those who are just now starting, good luck to you. Those who have just got accepted, congratulations, y'all. There are big things in your future, yours and mine both. Let's look forward to it. Keep positive vibes coming. I'll see y'all next time. Peace.